Not yet properly translated this in German, but this will be a challenge for us. But in English, it's called Designing for Life. And for us at Nobel Biocare, it has two essential meanings. One, we are committed, deeply committed to the original values of Nobel Biocare as they began to form with the discoverer of osseointegration, P.I. Brunnemark, in 1952, and as he treated his first patient, Gösta Larsen, in 1965. P.I., and I've had a number of discussions and tea and cake with him over the 2 years, is deeply, and always was deeply committed to the well-being of patients. It was his vision that, the way he said it, no patient should die with their teeth in a glass of water. He was committed especially to the edentulous patient. And we, I believe, have taken this original spirit and value to heart again at Nobel Biocare. And so we do put the patient in the middle of our discussion, and we do not treat patients directly ourselves, but we do want to help our customers treat patients and more patients effectively and better through using our products, components, and solutions. The second meaning for Nobel Biocare in Designing for Life is an aspiration to create, design, and produce products, components, whether it's software, surgical templates, implants, prosthetics, CAD/CAM prosthetics, to be of such a high standard, to be superior, that they can last the life of the patient. Now, many of you in the industry know that components on occasion break. Things need to be revised, improved. Not every implant integrates properly. But the first two patients treated by P.I. Brunnemark, Gösta Larsen, passed away about 3 years ago. His implants were still functioning. The second patient, Sven Johansson, is still alive. He's in his 80s, and his implants, the original implants, are still functioning. And so it is possible to design products of such a superior quality and to execute a treatment that it does last for the life of the patient. And this is an aspiration. This is what we want to achieve, what we aspire to achieve. So Designing for Life is 3 simple words, and it has some very clear and concrete meaning for Nobel Biocare. We can do amazing things for patients. In my 2 years, I've visited many laboratories, clinicians, practices, hospitals, and I have spoken to many patients, especially patients who have just exited treatment. It is amazing how the procedure can transform their life. If you have an edentulous patient or a cancer patient that has prosthesis, plastics, removable, and you give them a fixed prosthesis, teeth back in their mouth again, their reaction is amazing. They are grateful and thankful to their clinician. They can eat properly again. We don't recommend eating an apple right after treatment, but it is known to happen. They smile. I've heard patients talk that they cover their mouth. They have forgotten how to smile. They lower their lips. They smile with wide mouths. Regain self-confidence. These are all very real and tangible changes in a patient's behavior. And I have worked in many areas of healthcare, pharmaceuticals and diagnostics and specialized nutrition, and I have not seen a treatment procedure have such a profound impact on a patient's life as I have seen in implant dentistry. It is a wonderful thing. We I often show, here is an edentulous patient, no teeth. Right? Initial clinical situation, moderate bone atrophy, upper and lower jaw. Okay? The patient refused any bone augmentation, no sinus lifting, no opening the flap, no putting in augmentation material. They did not want to go through the time, pain, and effort. They wanted a minimally invasive procedure, meaning as little surgical intervention as necessary to get the results that they were looking for. This was a case by Professor Alessandro Pozzi. He works with us in Italy. He uses Noble Clinician, which we have innovated and brought to a leading position. He uses Noble Guide, which is a surgical template to allow proper placement. This is an all-on-4 procedure with Noble Replace conical connection, a new implant that we launched about 18 months ago. Tilted implant, it's a cutting-edge surgical procedure which has now gained great acceptance in the community. Right? All modern interventions, all innovations brought out by Noble Biocare in the recent past. And the maxilla, that's the upper jaw, an implant bridge zirconia from Noble Procera, 12-unit bridge, lower also Noble Procera implant bridge zirconia. For this patient, this kind of treatment would have taken maybe 12 months, 18 months if you had had bone augmentation in the past. Probably took about 12 weeks now. A better outcome, better material. And we are continuing to innovate in this area. We are at the forefront, at the cutting edge of innovation for patient treatment again. Now, at Noble Biocare, you heard the mission, Designing for Life. Designing for Life is also the name of our innovation program. Superior products and solutions. Partnering for Life is a cooperation that we have with our customers, the laboratories, the surgeons, the restorative dentists, the clinics. And Learning for Life is an activity that we have accelerated. You will hear more about it today. It is to regain the essence of what Noble Biocare did years ago, which is properly train and educate professionals to treat patients to the highest standards. So these are the 3 growth drivers that you will hear about, have heard about, and will continue to hear about in the future.